Hey guys, are you noticing your kids having watery eyes from time to time? I'm Dr. Singh, and in today's video, we're going to be discussing why your kids are having watery eyes, the causes, and the treatments for them. Watery eyes, aka epiphora, is one of the most common concerns of why parents bring their kids in for an eye exam. So today we're going to be discussing top 10 causes of watery eyes and how these can be treated. Before we get into it, let's take a look at the anatomy of the eye real quick. Tears are produced in the lacrimal gland and meibomian gland. The difference being lacrimal gland produces watery tears and meibomian gland produces oily tears. They cross the eye, enter the upper and lower eyelid punctum, travel through the canaliculi to the lacrimal sac and into the nasal passage via the nasolacrimal duct. This all is possible by contraction of orbicularis oculi muscle in your eyelids, which creates a pumping action that facilitates the flow of tears through the lacrimal system. All right, let's get into the causes and treatments now. The number one cause is blocked tear ducts. Tear duct blockage, aka nasolacrimal duct obstruction, is one of the most common causes of watery eyes in infants. Approximately 5% of newborns and infants have this underdeveloped tear ducts, which can become blocked. As a result, tears cannot drain properly, which results in backflow of tears, leading to watery eyes. Now, as there is backflow of tears, the normal bacteria in and around the surface of the eye stays stagnated in a warm, moist environment of the lacrimal sac. This can cause an infection called dacryocystitis. The majority of infants with blocked tear ducts spontaneously improve during the first several months of their life. If the symptoms are mild, there may not be any treatment needed. If you are noticing significant tearing or discharge, a digital massage of the lacrimal sac is commonly recommended. The goal of the massage is to force the fluid through the nasolacrimal duct and cause the obstruction to open. Now, you may be thinking, how do I do this massage? Well, it's very simple. First, apply direct pressure over the lacrimal sac. You may notice some mucousy reflux through the puncta, and this just means that the pressure is being applied appropriately. It is sometimes also recommended to stroke the finger in a downward motion over the lacrimal sac to open the obstruction. If there is significant mucus and pus discharge in the eye, treatment with antibiotic drops is also recommended. This is usually done to tackle the infection. The benefits of antibiotic drops are usually temporary, and symptoms often reoccur when these are discontinued. So getting rid of the obstruction is key to solving this issue. If these conservative methods have been tried and failed, nasolacrimal duct probing surgery can be considered, and this has a fairly high success rate. Reason number two, children can develop allergies to various environmental factors, including pollen, dust mites, pet dander, or certain foods. Allergic reaction cause inflammation to the eye surface, which shows up as watery eyes, itching, redness, and sore eyes, along with other allergy symptoms. Treatment is successful with conservative therapies like cold compression to the eye, and in some cases, anti-allergy drops or anti-inflammatory drops may also be prescribed by your optometrist. Reason number three, any exposure to irritants such as smoke, pollution, or wind can lead to red and watery eyes. Foreign bodies like dust and debris can also irritate the surface and cause tearing. This reflex tearing is usually a protective response to clear the irritant. This is usually temporary and not a cause of concern. If you suspect exposure to irritant is the cause of your watery eye, washing the eye with cold water and using preservative-free lubricant eye drop, doing some cold compressions will help tremendously. Reason number four on the list is infection, what is commonly referred to as a pink eye or conjunctivitis. Eyes will be red and sore feeling along with having yellow and pus-like discharge or just watery discharge. If you suspect your child has an eye infection, seek an urgent evaluation with your eye doctor. proper diagnosis of what we're dealing with, viral or bacterial or any other etiology, is important to get proper treatment. Reason number 5, blepharitis. What is blepharitis? Blepharitis is the inflammation of the eyelids, and in most cases happens because you have too much bacteria on your eyelids. Having bacteria on your skin is normal, but too much bacteria can cause problems. The excessive bacteria sitting on the base of the eyelashes can cause irritation and an inflammatory response, which will cause excessive watering. Number 6, dry eyes. Yes, we're talking about dry eyes in kids. Have you seen this in your household? Unfortunately, a common finding. Paradoxically, dry eyes can lead to watery eyes. Shocker, right? Here's 2 ways this is happening. First, when the eyes are dry, the body may produce excessive tears in response to the irritation on the eye surface. And second, due to blocked meibomian glands. These glands secrete oily layer on the tear film. If it becomes blocked or dysfunctional, the tear film may evaporate too quickly, leading to dry eye symptoms and, paradoxically, watery eyes. More on the dry eye in my next video. Treatment for this can include decreasing screen time, warm compressions, and using lubricating eye drops. Number 7 on the list is uncorrected astigmatism, farsightedness, and focusing issues. This will cause strain on your kid's eye. The strain on the eyes present as eyes being watery. Remember, a comprehensive eye examination allows your optometrist to detect, treat, and manage these conditions so your child is able to have a better visual performance and a promising future ahead of them. Number 8 on the list is eye turn and eye muscle imbalances. If kids have any eye muscle misalignment, this could lead to inability to focus or perceive depth. This can cause strain on the eye, which leads to watery eye. A comprehensive eye exam can detect these issues and resolve these with corrective eyewear when needed. Number 9, a less commonly seen, eyelid problems and structural abnormalities. Issues with the eyelids such as entropion, which is inward turning of the eyelid, or ectropion, which is an outward turning of the eyelid, can disrupt the normal distribution of tears, leading to excessive tears on the eye. Again, another less common cause is a closed or underdeveloped opening in the corner of the eye called a puncta, where tears drain into the tear duct. Surgical evaluation may be considered to treat these issues. Number 10 on the list, and also a less common cause, is congenital glaucoma. In this condition, pressure inside the eye increases because there is a birth defect in the development of the drain inside the eye. This means that the fluid inside the eye cannot flow out normally. This increases the pressure inside the eye, which in turn causes symptoms like watery eyes, red eyes, enlargement of the eye, sensitivity to light, and involuntary twitching of the eye, and many more. If your child is experiencing persistent or recurrent watery eyes, it's essential to consult your eye doctor. They can perform a thorough evaluation to determine the underlying cause and recommend appropriate treatment, which may include eye drops, antibiotic drops, allergy medication, or surgical intervention, depending on the specific issue. If you found this information helpful, I encourage you to share this with one other person that would benefit from this. I would love to hear your experience about watery eyes and the symptoms we discussed today in the comments below. If you like this video, please subscribe and follow us for more videos on your eye health. Thank you for watching this video. I'll see you in the next one.